If you're dealing with plantar fasciitis, a whole mess of ankle sprains, maybe some Achilles junk or some cranky knees, this could be the video for you. Sometimes having a stiff foot can be helpful. Other times it wreaks havoc on performance and can be the source of a lot of pain. So today we're going to talk about what we can do if you got a couple stiff feet attached to your legs. So the two basic foot shapes are supination with the higher arch and the heel bone tilted in, and pronation with the arch that's closer to the ground and the heel bone that's tilted out. Both shapes are important for their own reasons. The supinated foot allows us to push off of one leg and get onto the other leg, and the pronated foot allows us to dissipate the force of us hitting the ground. It allows us to hit the ground a little bit softer so we don't have as many stress reactions through bones or tendinopathies through muscles that get stretched a little bit too quickly. So this video is for the person that probably has the higher arch foot and a foot that doesn't really change shape a lot. There's absolutely nothing wrong with having a high arch foot. We just want to make sure that that arch does move. You can check out my last video if you want to get an idea of how well your foot moves and if this is something that you should pay attention to. There's two places that I like to focus when I'm trying to get a stiff foot to move again. The first one is going to be the rear foot. So that's just the heel bone, mostly. I think of the heel bone as a rudder on a boat. So wherever this rudder is pointed, that's where your body weight's going to go as it progresses through your foot. So if your heel bone's tilted out, it's going to point you and it's going to direct you to the outside edge of your foot. The second place I like to pay attention to is the midfoot. So that's just this whole mess of bones right in the middle. Whether it's a pronated foot or a supinated foot, our foot's actually twisting. So the back of our foot and the front of our foot are doing opposite things. So we need to have a pretty good amount of movement through the middle of our foot. And one of the principles I like to work off of is if there's a lot of bones and joints in a place, there should probably be a lot of movement in that place as well. So I've got 4 things for us today. The first thing we're going to do is we're going to take our foot off the ground. I know I've been talking about having our foot on the ground to really assess pronation and supination, but we're going to take our foot off the ground and just see what does our heel bone do and how well can we get our foot to twist. The second thing that we're going to get into is just putting our body weight on our heel and seeing if we can get that heel to tilt out just by shifting our body weight forward and backwards over top of our heel. The third thing we're going to do is we're actually going to take our toes away from us. So sometimes we can use our toes to claw or press in the ground and that'll stiffen our foot up. So if we take our toes off of the floor, it makes it a little bit easier for us to access that midfoot and just see that thing move as our body weight stays over top of it. And finally, the fourth thing we're going to do is we're going to access that pronated foot shape and we're going to produce force. So I'm actually going to push into the ground while I'm in this pronated foot shape. I'm a firm believer of producing force in a shape that we have a hard time accessing. We're going to do everything we can to access that position. We're going to get there comfortably and safely, and then we're going to produce some force so we can encourage our nervous system to hang on to that position because it's a place that is both safe and important. So we're going to start just by manhandling our tootsies, right? So I'm going to grab one bare foot, cross it over my hip, and if we go on the inside edge of our heel bone, so there's my ankle bone, here's my heel bone. If you feel through there, there's a little bit of soft meat, kind of on the front edge of it. What I'll do is I'll just start rubbing through there a little bit. That is the attachment of a muscle called abductor hallucis. That guy can get pretty tight, and that'll just hold that heel bone tilted in. So don't be surprised if there's some pretty gnarly tender bits in there, but I'm just gonna kind of gently push through there. Don't try to be a hero. Don't prove anything. There is a nerve and an artery in there, so if you start feeling like tingles or wild things in your feet, you didn't win, you're just doing something silly. You're squishing a nerve. So push on a different spot. After I do a little bit of that, I'm just gonna lean into this heel and I'm gonna kind of hook it with the pad of my thumb and I'm gonna press down. If you have clammy hands or sweaty feet and a voodoo band, this can sometimes make it a little bit easier. So I'll just grab that and then I'm using the voodoo band as a little bit of support, like a little tackiness to get a better grip on my foot, okay? That's how we're going to try to get the heel bone moving. After I spend some time on my heel, I'm going to move on to my midfoot. But to do this, I have to get my fingers in between my toes to have a pretty wide forefoot. So if you have a hard time getting your fingers in your toes, just start with this. Get your fingers in there and hang out. If you have a hard time getting fingers in toes, this is a time where those toe spacers can be helpful. Once I get this position going, I'm going to grab the top of my foot and I'm going to start wringing my foot out like a towel. Remember, in pronation and supination, we get this big twist through the middle of our foot. So I just want to make sure that that's even possible before I try to do that standing. So if it didn't feel like you accomplished a whole lot with your heel bone on that first exercise, that's okay. We just wanted to kind of like get the ball rolling. I think about like leaning into a rusty door. Once I get a hair of movement happening, these next exercises are gonna be a lot easier. So I'm gonna use a slant board. I like to put this on a pretty low angle, and I'm going to stand on it sideways, right? So if we think about what I need my heel bone to be able to do, I've essentially just put my heel in that tilted out position in that pronated foot shape. So what I'll do, I'll stand sideways on the slant board. I'm gonna support my weight on my squat rack or anything really, have my knee nice and straight, and I'm gonna feel my weight go straight down into my heel. Just in this position, I should be getting a little bit of a stretch here, and if I bend my knee and let it go towards my first toe, I'll get even more of a stretch. So in this one, I'm just gonna kind of move in and out of that position, feel the stretch, keep weight in my heel, and as that stretch gets less intense, I know I'm getting more and more mobility out of that joint complex. This next drill can be surprisingly difficult. So what we're gonna do is we're gonna stand on an elevation. It can be a plate, it can be a step. I got a 4-inch box. I'm gonna have the base of my toes on the box, but my toes themselves are gonna be hanging off. What this does is it makes it really hard not to put weight in your midfoot. So you don't get to use your toes to scrunch your foot up and keep your foot really rigid. We kind of force your foot to change shape here. So I'm gonna put a slight bend in my knee, because with a little bend in my knee, I'm gonna load my foot more. So I'll just start with a bend in my knee, my other foot off the ground, and can I balance here and have my toes pretty chill and kind of maintain my balance. If you're having a hard time like feeling your midfoot or feeling your foot move, I'll put a sock or a little wedge underneath the arch of your foot, and we'll just get back into it. Once balancing here feels pretty easy, we progress to clocks. So I'm gonna reach forward, tap my heel to the ground. I'm not gonna unload my weight. In front of me, next to me, and then behind me, okay? So from here, bend my knee a little bit more, gets me into my foot more, tap that heel, reach to the side, tap the heel. This one gets squirrely. I'm gonna open my hips, and I want my knee to go forward as I reach back with my other foot. This is gonna be the most difficult position, and then we'll come on back. I like to move through progressions of that clock. I usually do sets of 3 or 4 clocks. The first time I did this drill, I legitimately fell over. So be nice to yourself. Be patient. This is gonna be good. Okay, so this is gonna be our soleus slouch. In the last video I posted, we talked about this pronation drill and how we can really get our body weight over top of a foot. So I wanna be in a little bit of a positive shin angle. My heel is planted on the ground. I feel my weight through my foot, and I'm kind of relaxed through the rest of my body. And the first thing I'm gonna do is I'm gonna take a nice lazy exhale, and I'm just gonna slouch down over top of this front foot. Okay, so my knee is gonna stay over top of the base of my toes as I continue to reach down. I'm trying to keep my weight in the middle of my foot as I continue down towards the ground. The more I reach down, the more I get a lot of my butt and a lot of my like deep calf soleus. So I'm gonna get to the bottom position here, which is like my fingertips on the ground, slight bend in my knee. My foot is glued to the floor. From here, I'm gonna think about squishing the bottom of my foot in the ground. I'm pushing into the floor until I start moving up. I'm not thinking about standing up. I'm thinking about pushing into the floor. It's gonna feel like way more work than you would anticipate, and you might get a little shaky all the way up to the top. But that's just because if you do have a stiffer foot, producing force and moving through that pronated foot shape is really novel and something that you may not have done in a long time, if ever. So I like to do sets of like 3 to 5 of those because there's a lot going on, and as you fatigue, you're gonna feel yourself dumping into that supinated foot shape. So there's 4 of my go-to foot mobilizations. If you find yourself with a stiff foot that's giving you some issues, I'd try to do that probably every other day and maybe spend like 10 or 15 minutes on it. Check out my video next week for more ways to develop and maintain your health, fitness, and athleticism.